neurological. The diagnosis depends primarily on clinical judgment, so not on the EEG and testing. And the underlying mechanism of epilepsy is an abnormal cortical discharge. So there's something wrong with your brain if you have it. I'd like to play this piece and may the sound go through.
Hello, my name is Thea Van Der Merwe. I'm the chairperson of Epilepsy South Africa, Gauteng, but I'm also a psychiatrist and I have epilepsy. My epilepsy was diagnosed quite late in life. I was already a psychiatrist, but I've had the epilepsy my whole life. I have partial seizures, so people don't often see it if I have a seizure. But I had some things that went wrong in my life that is definitely due to the epilepsy. I could fight with people and not remember what I said to them. I didn't know what I ate for breakfast the previous day. It depended on the if I could remember or not, and often I couldn't. I had deja vu, where I thought that things have happened before, or that I knew things which I didn't. And that made people angry because they thought, you're a know-it-all. But for me, I really did know it. And that's part of the epilepsy problem. I had 7 accidents, none of them a big accident. Nobody died, but 7 car crashes. And because of that, my neurologist told me for 10 years that I'm not allowed to drive. So I had drivers that had to drive me around. And then one day on weekends, I asked my family and friend to drive me. And then my brother said, no, he's not going to drive me. And that was my introduction to taxis. And some taxis without any floor that you can see the road beneath you, and the guy that smokes so much and then sprays taxi full of deodorant. It was a complete different experience for me. The minibus taxis, because on weekends that's how I had to get around. My husband tended to work on a Saturday, so Saturdays it was either home, or I had to pay somebody, or I had to get a taxi. I've got a lot of side effects on the medication. I gained a lot of weight. I have a tremor. But that's how it started. This started with me not being able to operate because I wanted to be a gynae. And I couldn't operate. And the reason why I dropped instruments was not discovered till 5 years later after I completed my psychiatry. So there's a lot of effects that epilepsy have on you and that the treatment have on you. But the treatment has given me independence. It is allowing me to work. At this stage, I'm back to driving short distances. And it's allowing me to have life. And having had epilepsy and living through it, I understand my patients a bit better. I can quicker diagnose epilepsy because I've read
Ja, dis
so
because
much
ek
on epilepsy.
dis
And
wat ek pot
I understand the family reaction around it. So epilepsy have given me a lot, but yes, it has taken a lot. But epilepsy is an illness. I am not epilepsy. I'm a psychiatrist, I'm a doggy mum, I'm married, I do some embroidery. So there's life outside of the illness. But no, the illness do take, and it is a severe illness. And it does not have to be the tonic-clonic that everybody knows, which is the physical fall down. It can just be a brief cutout, which has a huge influence on people's lives and futures. So, I'm Thea Van Der Merwe, I have epilepsy, I'm a psychiatrist, and I'm actually happy with my life.
Just so that we can go back to uh, so that is a little bit about me. What I didn't tell in that video is that my whole family has epilepsy. It's a genetic one. And our main thing is that we throw tantrums. So when I have a seizure, I throw a tantrum. So this is sort of what happened in the beginning of my treatment is, since first day, tantrum 3, that means I have no seizures. And then I would count from tantrum to tantrum. My family has decided not to acknowledge their epilepsy. Or I can see it in them, but they decided not to get treatment. So that's sort of where I'm sitting in the family group, is that a lot of what happens in the family group is my family, because I have to put the boundaries in. It is one of the few diseases that the incidents differ around the world. Good health services matter. It ranges from 1 in 20, which is about where South Africa sits, to 1 in 100, where the United States is. So the incident in substance abuse doubles what we see here. So that means at least one person at a time in the rehab will have epilepsy sometime in their lives. So this is the WHO, says it's 1 in 26 people, but remember then they take the Americans and the third world countries and us in the middle all together. We're probably a bit higher than that. 1 in 4 people will have a seizure in their lifetime, because a seizure does not mean you have epilepsy. A seizure is one of the things that, if you have repeated seizures that is not caused by something else, you have epilepsy. So everybody can have at least, or 1 in 4 people can at least have one seizure in their lives. And that does not mean they have epilepsy. If you look at what the WHO say about epilepsy, is that 90% of times we do not know what caused epilepsy. We just know that it's there. We know in the 10%, it can be infections or stroke or a head injury or the genetics or brain tumors or a birth defect. But 90% of what we know about epilepsy, we don't. Seizures that can lead to epilepsy. So what causes seizures? Remember, seizures is people that don't necessarily have epilepsy, but they can have a seizure. It's that 1 in 4. Is alcohol withdrawal, which is what we often see, and the reason why the patients the first 4 days is asleep, because we try not to get them to have seizures, because that's brain damaging. Bites and stings and brain infections and brain injury, a brain defect at birth, choking, drug abuse, drug withdrawals, electrolyte imbalances, electric shock, epilepsy, extremely high or low blood pressure, fever, head trauma, kidney and liver failure, and low blood sugar and poisoning and a stroke. If these things causes a seizure and you have another one and another one, then it becomes epilepsy. If you have 2 seizures that's unprovoked, it gives you the diagnosis of epilepsy, 2 a year. And what substances can trigger epilepsy? Now, these are also the substances that can give you epilepsy, seizures, that is not epilepsy, but they can also trigger epilepsy. And that's alcohol and crack cocaine, benzodiazepines, and opioids. However, they can trigger the epilepsy. And if people are high on whatever other drug and they get a head injury, it can cause epilepsy and seizures. So we see this addiction quite often. And when we try to withdraw the patients from it, we put them on benzodiazepines for a few days, so just to stop the seizures, but they can cause epilepsy. So it might be long-term epilepsy. And there's different types of epilepsy. And this is the part that makes it so difficult for people. There is simple partial, which I'll explain a little bit later, and complex partial. It's only when half of the brain is affected with a seizure. Secondary generalization is when half of the brain starts, but it becomes the whole brain. And grand mal and petit mal, which is generalized seizures. Now, the petit mal, what I didn't tell you is that I'm happy enough to have 2 different kinds of seizures. which makes it even more difficult to diagnose initially and gives me huge fun because I can say I have this, this, and this, but it's that kind of seizure that's acting out, or this and this, and it's that kind of seizure. So grand mal and petit mal. Petit mal is the one that everybody talks about, which is the cut-out seizures. It is the reason I have 7 car crashes. And then it is the grand mal, which is a typical seizure that we see and we know. 60% of epileptic patients have partial seizures. So they never will have one where you can see it, where they cut out or when they fall on the floor. 20% of people with epilepsy have non-epileptic seizures. Now, non-epileptic seizures is often anxiety-based. They have normal seizures, but then they also have psychological seizures, non-epileptic, psychogenic non-epileptic seizures. And that is a big part of what I use, that I treat, is the patients who does not have an abnormal EEG, but does have seizures, or that has an abnormal EEG, but also have these seizures that is non-epileptic. And then you have 30% with the general-like seizures that people see. You can have the cut-out petit mal in generalized seizures, or tonic-clonic, or myoclonic, which is just the muscles. And this is the typical seizure we see, where there's the tonic phase, where everything gets together, and then the clonic phase, where they move, and then post-ictal, where they just sleep and they're confused. And they often don't remember their names, they don't remember where they are. The partial seizures is divided in simple and complex partial seizures. Simple partial seizures, you actually don't lose track of what's around you. And it might just be your thumb moving up and down that is the seizure. Or it might just be pins and needles in part of your body. Or you might just have a strange taste in your mouth. Or you might just have changes in emotion. And that's the problem. Often the epileptic patients that psychiatrists ends up seeing is those that have this rapid emotional change without any reason. So they will sit and smile and laugh at you, and the next moment they will start screaming at you. Or they might scream for a fight, but it's not a big deal. It's like a normal fight. But then they just go on and they get out of control. Complex partial seizure is where you lose sense of what's around you. And you might have repeated jerking movements, lip smacking, picking on your clothes or chewing, voices, sounds that you make, and you have no ability to respond to questions. Versus with simple partial, you actually have ability to respond to questions. So the big thing about complex partial seizures is that we often see it in our patients and they don't realize it. They have it the whole year, that they have the dreamy state and blank expression and the deja vu or the fear. Most of my patients tells me, I cannot explain to you the sensation I'm having. It is not explainable. How does it feel? I don't know. It just doesn't feel right. And that is often the part with epilepsy, and people say, how can you tell me that you're not feeling right? You must have something wrong with you. And they can't. And then they start lying because people want an answer, and then the children will start giving an answer. Diagnosis is the most important thing, is the history. Long term, it is often comes and goes. It's longitudinal, repetitive. So there's like a school system. They do really well for 2 or 3 years at school, and then they do really pathetic. And then they do really well, and then they do pathetic. And it's literally as the tide of the ocean comes and goes, and it's there or not. And you need to have somebody that have an idea to make this diagnosis. Then they can do an EEG, which can be a long EEG, and an MRI. MRI is actually just going to show if there's a big problem in with your epilepsy, like a brain tumor. It's not going to show anything else. And the EEG is horrible. I know that quite a few patients in Changes get the EEG. They get overnight EEGs, which is about 80 to 90% accurate. The short EEGs that people often do is less than 50% accurate. And then even the 3-day EEGs is not that accurate. But yes, you get all the wires on your head and then you get told, sleep normally. It's no big deal. There's often symptoms seen and not often discussed in epilepsy. And one of it is the aggression. The aggression can be quite overt, or it can just be verbal. My family has a verbal aggression when they have a seizure. The tide of the ocean is literally that for 2-3 years in your life, you're doing well and they're not. My dad said he never wanted to bring up another daughter like me because I did really well in primary school. And then standard 6, 7, and 8, I did really bad. And then 9 in matric, I did really well. And he says he didn't know I could walk out from a test for 20% for the test or 100%. And there was no, I didn't know what I was going to do. I also got into a fight with a professor at medical school and had to pay quite dearly for it, which I don't even remember. I just got told I had the fight. I don't remember it. They often lie. If you ask people, what did you eat for breakfast? And they don't know, they're going to tell you they had eggs. And if you ask them, did you do your homework? And they don't know, they're going to say yes. So these simple lies that has no reason. It's not like they're trying to get away with something. It's just lying that doesn't make sense. Then also, epilepsy gives you quite a weird personality. They call it a syrupy personality. It does get better when you're on treatment. And it's where you almost all over people and you don't have personal distance. It also, with epilepsy, goes the mental illnesses of ADHD, substance abuse, anxiety, depression, and cognitive impairment. You also have with epilepsy the part that nobody ever tells you about, which is the sudden death syndrome. You have about a 1 out of 8 chance of dying for no reason. And medication doesn't make a difference. But nobody talks about that ever. You can also get high blood pressure, diabetes, there's hormonal shifts. So your hormones are never normal. And these things happen off medication and on medication. So it's not just medication causing that. Medication, what can you do? I hate it. But if I miss one day, which I happened 2 years ago, I had seizures for a weekend. So I spent the weekend in bed with seizures. And I got kicked out of driving for 6 months. So I just take it. I don't complain. There's some other things that you can do, which is a gluten-free diet, a ketogenic diet, limit your coffee, and more. If I have one mouthful of alcohol, I do have a seizure, guarantee. If I drink too much coffee, I have seizures. If I don't sleep, I have seizures. This is an important way of looking at how you can help people that does have seizures. If they have a seizure, please do not put anything in our mouths. You're going to bite my tongue and I'm going to bite your fingers off. Just leave my mouth and turn me in the recovery position by putting my hand onto my head, the other hand on top of it, so that there's a cushion for my head. Turn me around, let me lie on my side, and just leave me. If I have more seizures than 5 minutes of seizures, please call the doctor. But before that, just leave me. I'll sleep and I'll feel better. This is quite an interesting one that I want to show you. I can't cook without a partner anymore. I have to use a microwave. I have to use non-breakable dishes because my dishes break. I go through quite a lot of crockery in my house. I can't drink very hot food or liquid. I have to shower. I can't take a bath. And that's quite painful. If I have to take a bath, my husband has to sit on the side of the bath and watch me. And then, you can't move your bed next to a wall because you might get into it. You can't have sharp corners in your house. There shouldn't be any cords and tools and toys because you'll fall, hit your head, and have seizures. And no power tools or kitchen appliances, which I'm quite happy about. I have married a chef. He can do the kitchen appliance thing. And I can't drive, which is the This is the big things that they normally tell you, but they don't tell you can't chew chewing gum either. But you can't hold babies, you can't drive, can't have hot coffee, can't get up on ladders. If you swim with somebody sitting right next to you, and be careful of bumping your head. So, medication side effects. My biggest one is my memory is gone. So whenever I see this box, I think maybe it's not that far gone, but I think it's gone. I say if you say your memory is fine, then it's definitely there's a problem. If you say that it has worsened my memory, then it's probably not a problem. I did have memory problems even before I had a seizure, as I told you about the breakfasts. I can't remember what happens during a seizure or right after a seizure. That's gone. And the longer I've had epilepsy, the worse my memory and concentration get. And yes, the medication has some lovely side effects on your memory and word finding problems. I often can't find a word, so I'll say the Afrikaans word. I have those kind of side effects. I have a 3 to 6 times greater risk of death. We don't know what causes epilepsy. 75% of people do not receive any treatment, and 80% live in the low and middle income. So we know it's part of the poverty thing that people have more epilepsy. And there's always the social distancing, work and family. My family is not acknowledging their epilepsy because of the stigma. Work is, I can luckily work with my epilepsy, and social distancing is 2 ways. Yes, the people are upset with you, but also you can't go out. So I want to end with please support epilepsy awareness. It is this week, epilepsy awareness.